Tonight here at 10 o'clock, we wanted to bring you the experience of a local doctor who has been face-to-face with COVID patients day after day. KCTV5's Betsy Webster spoke with him.
The doctors and nurses at KU Health System take pride in providing quality care with emotional warmth. But dressed like this, it's harder for Dr. Chris Brown to convey that to those who are suffering on the 2 isolated floors of the hospital. Each floor is equipped with negative airflow rooms and an ICU set aside solely for patients who are COVID positive and those being treated for symptoms while awaiting test results.
The warmth of medicine, again, the smile, they have no idea what my smile looks like.
For the past 3 weeks, he's been working exclusively where the halls are lined with respirators and hoods for the staff. Today, there were 9 patients on ventilators and 2 more in the ICU. Dr. Brown preps himself each day for the reality that lies ahead.
I mean, patients can become very, very sick very easily, very quickly. Things change on a dime.
The impact of the coronavirus affects not just those patients, but all of them and their loved ones because they can't go inside the hospital anymore. So whether it's cancer or coronavirus, they can't sit bedside to comfort them. But for the highly contagious coronavirus patients, there's an additional category of care. Doctors and nurses are monitoring both the patients here in person while also making frequent phone calls to monitor friends and family who've tested positive but haven't yet needed to be hospitalized.
There have been a couple times where I've had to literally call the family member and ask them to call 911 to present to the hospital.
He says the question he gets often from loved ones is, are they going to die? It's a question with this coronavirus that he just can't answer with the usual labs and imaging.
I've seen patients that they look really sick and they make it out of the hospital in 72 to 90, within three days. I see patients that look completely fine and within a couple hours they're in the ICU.
Asked what the rest of us can do to help him and his fellow medical workers, he answered like he simply hadn't considered that question before.
Prayers. prayers, and just know that we're working hard to take care of their family members, their friends, their loved ones. I mean, that's just it.
Betsy Webster, KCTV5 News.